Is the mental health crisis in Canada a real problem?
This has now caused a lot more, anxiety for people, a lot of fear, a lot of isolation.
Is it is it possible for the brain to change the physical state and structure itself? So today we gotta work together in a very different role. Yes, in my podcast, which is we call it common sense. Yes, and I'm gonna be the host today and welcome Andrew to our podcast. Today we're gonna talk about the mental state in Canada specifically, and if we have time, we can bring it to other countries in the world. And so, from your point of view as a social worker, is the mental health crisis in Canada a real problem?
So just a little background. I'm a social worker in a long-term care facility in Ontario. In my opinion, it is a very big problem. Approximately, it's about 1 in 5 Canadians experience a mental health illness itself, and that's every year. It's quite frequent, and it's one of the leading causes of disability in Canada itself. Poor mental health really impacts people's ability to live and to function the way they want to. Also, we've just come out of a pandemic itself. So the COVID-19 pandemic really hit and worsened all these states for people. So this has now caused a lot more, anxiety for people, a lot of fear, a lot of isolation, not being able to go out and access services, to even go see their doctor. And then, a lot of that as well is stress from everything, from, the constant change of information being sent over, like, what was safe, what was not safe, what vaccines would work, would not work, which, there's so much going on. And then a lot of, grief over the loss of life and just people not being able to be there, in times of people's needs. So, there's just a lot of that, and that's just worsened everything that's kind of come of that. And, even if you just ignore all that has come together to, with governments looking at, governments in Canada, so provincial, territorial, and federal, just to look at, the rate of access that's needed for mental health in Canada itself. And they've all agreed to kind of pursue this. The Ontario government alone has decided to invest, I think it's about $3.8 billion over the next 10 years just in access for services. And, it's at that point, even just my social work perspective aside, it's a big concern.
Very true, very true. Just for the context and for the insight for people who doesn't or maybe are not even aware of that they have a mental health issue or mental health condition, how a mental condition impair the ability of somebody to live normally?
That's a great question. It helps. It impacts a lot. Sorry. A lot of the ways it contributes itself, a lot of the way the world contributes to it is essentially through what's called the social determinants of health. So these are factors that essentially are, if they're good, we typically have positive outcomes. If they're bad, we typically have bad outcomes itself. And so, these include everything from how much money you make, what kind of education you get, if you are employable or not, access to food, your working conditions itself, housing, the environment you live in. So, if you can afford to live in a better neighborhood versus not, access to services, just even your, as you're growing up, so your childhood experiences itself. If you live in a positive environment, you'll typically be more well adjusted. But as you live in more poor countries or poor areas of the world itself, that impacts that itself, and how your brain develops and how you perceive the world and how your body kind of reacts towards all of that itself, and even just how included you are in society itself. So there's a big talk about the LGBT community itself, and how they're viewed included or not, and that impacts how their mental health. And so there's so many factors that are linked to it itself. So it's there's a lot to it.
It's a lot, absolutely. And and once it's happened, so I find it very interesting when you mentioned about the brain factor in there. Um, is it possible for the brain to change the physical state and structure itself along the way? It depends on our environment, depends on our social circle, depends on everything happen around us.
Oh yeah. So there's a lot of research right now into neuroplasticity, which is kind of just in a simple term, just kind of looking at how the brain can change itself. And the main thing that you can really see is that as when we're children and you're younger, the way we've I should actually start before we're even born. The way our genes are passed down from our parents already influence things about us and how things might be expressed and what factors might come into play. And then through a concept that we used to kind of refer to as nature versus nurture. Have you heard that before?
Yes.
Yeah. So basically now these days it's more commonly thought of as nature via nurture. So with all these genetic factors that have come from your parents and your family and states of the world and stuff like that, even previous traumas experienced by older generations and stuff like that have been known to be passed down itself through our genes and stuff like that, and then our environment is how it gets expressed. So if you live in positive environments, some of the bad stuff might not come about, but as we live in more difficult and adverse conditions itself, more of those will become expressed in a different way. And so the brain changes literally to react to protect itself. And then while that's it's kind of seen that's kind of how things go across someone's lifespan. Nowadays people are using a lot of like mental health services and stuff like that to start to change that stuff, so the brain can relearn. But it takes a lot more time because a lot of those patterns have come into place, or even the way the brain processes things. It's developed it for so long. It's been reinforced for so long that it takes a lot of time to change. And as a personal trainer, you see people all the time who have done things a certain way. Whether if they're training to be a better athlete itself, and they've kind of done everything, and you go and it's like, oh well, no, this is how the form should be, so let's kind of correct that, right? It takes time because they're so used to doing it a certain way. Same thing. So the brain has to relearn, and it takes time. It takes a lot of resources, a lot of energy. So it's not a simple process, but it is doable itself.
That's interesting that you bring it out, because in my work, where I see people who comes to me and ask for help, there's a very high ratio of them that they know what they need to do, and they've been failing exactly the same way times over time, and they just don't understand why they can't change, even though they know very well that what they need to do to change, right? Yeah. And for me, it's very interesting to actually talk to those people to understand how I can help them to change. Sometimes it helps, sometimes it doesn't.
That's fair.
Yes. And I always think that in my mind, like, how hard can it be to change your behavior in one way? Until one point, I just realized, yeah, it's difficult. Since I literally just do the same thing that I've been doing forever.
Exactly.
Right. Yeah. But you also mentioned about people who live in a positive environment tend to have a little bit better outcome in terms of their mental health and all the stuff. What contributes to a positive environment? What makes an environment positive?
That's a great question itself. So, I mean, like I mentioned, the social determinants of health, but what that would look like to a person itself. So, an environment where there's not a lot of crime. Someone can feel safe going out and kind of living the life they want to. They don't have, they have a job that they, feel fulfilled in. They make an income that is sustainable for them, for their needs and what they want to do. Whether it's traveling, affording a house, affording a car because they need to travel more often. Um, you know, uh, the environment also needs to be, engaging with, like, if there's like nothing to really do, obviously that kind of impacts in terms of what kind of things, kind of activities people engage in and stuff like that, right? You keep preoccupied, they'll do things that are typically more involved and healthy for them. If you don't have that stuff, obviously people are going to choose vices that are probably not the best itself. At the end of the day, they have their right to make that choice. Everyone's path is a little bit different. What else? So income, a good house, as I mentioned, food access, even a positive relationship with their parents and how they've grown up and stuff like that. That's a thing. While we may experience loss and stuff like that, we're able to, or just challenges, we're able to grow up in an environment where we're validated, our emotions are understood, or not belittled, or not pushed to the side, because that's where we get into territory of what's called attachment theory. So basically, how children interact with their parents, and those behaviors become reinforced over time, will actually impact a person's ability to work with their future relationships. So kind of how that looks. So a child who has parents that are responsive to them. So like if they cry or if they get hurt, their parents come and see them and make sure they're okay, and they do that consistently, time and time again. They'll typically have more of a positive coping style itself, and they know they can explore, but they know they have their support. And but then you get into other coping styles where attachment styles where if parents aren't readily available, or choose to ignore, they start to become these children start to become avoidant. So they don't want, or they they actually push their parents away, because they don't see them as an actual positive force in their life. And some just become ambivalent and stuff like that. They don't care if they're there or not. So all of these really impact how someone can develop, and what contributes to an actual good environment itself. But even irrelevant of just like childhood experiences, if the environment is conducive to retraining someone to learn that, like, oh, I can rely on my neighbor, or I can rely on the shopkeeper or something like that, right? Then people learn to develop better habits and stuff like that, and better coping mechanisms, and just the way that they feel more fulfilled and happy in their life. And then as a result, that leads to better outcomes, and then just to a better overall person.
Right. So it's doable to learn a different coping mechanism.
Mm-hmm. Yeah, it's difficult, and I will say this: there's no easy path to just learning a new mechanism. If someone's been avoidant for all their lives because they feel like their parents were, they saw their parents not being there, and then and a lot of the relationships growing up have been like that. But then they get put into a new environment. They're obviously cautious of it, right? You don't know who to trust. You don't, and the anxiety in it there kind of scares you into, do I want to trust them? Well, the last time I tried to trust someone, it didn't really work out for me. And so it takes a lot more energy to really retrain the brain to really work with your environment. But having those, and there's a kind of a famous theory that kind of works with that. It's called Maslow's hierarchy of needs itself. So once someone has a more positive environment, starting out with their biological needs, so housing, or sorry, like food, water, and stuff like that, the basic things they need to live in life, they're able to go up this hierarchy. So to belonging, to housing, to then start to developing more positive emotions, and then to actually wanting to push themselves to be a better person and stuff like that. But they have to fulfill those previous steps, otherwise they can't do it, right?
Of course, yes. Um, then if that positive environment get reversed, it's become a negative one.
Mm-hmm.
Is there any other thing than a negative environment that contribute to mental health issue?
So just so I'm clear, so if like someone who's generally positively adjusted goes into a more negative environment itself.
Yes, and also like outside of just negative environment itself, right? Along that, are there any other factor that contribute to a mental health problem?
Yeah. So like I said, a little bit earlier, our genes are kind of important to that itself. You know, if you have family members that have gone, that have a diagnosed mental health condition, typically that is something that might get passed along itself, right? Just the same thing as like typical health conditions, right? If someone's prone to Parkinson's or something like that, that gets passed down over generations itself. And then so depending on how the environment interacts will may increase the chance of that being expressed. So if someone is, let's say, has a gene that is passed down, and they have a history of depression in their family, so that's something that's constantly passed down, let's just say from both sides of the family itself, then they will essentially, if someone who doesn't have good coping mechanisms, or even has a lot of their good social determinants of health sort of stripped away from them for whatever reason. So if you lose your job, you lose your house, you lose all your relationships and stuff like that, obviously your coping mechanisms disappear itself, and so you will experience that gene will get more and more expressed, and that it will impact you, and probably more significantly itself.
What can we do to lower the risk of being into that state?
That's that's a very interesting question. As a social worker, my whole job is to kind of advocate for people, and ensure that depending on the situation itself, they have the tools they feel they need to really to live a more fulfilling life. A little bit different in the way I work compared to other social workers in the community itself, or different organizations. So, like I mentioned, I work in a long-term care facility. So, a lot of people that come to see me are typically older, and aren't able to live in the community independently itself. Um, Whereas, social workers in the community, which I do as well, in certain capacities, try to navigate the system. So, getting an income at least. So if someone doesn't have an income, having some source of income, or through disability programs, or welfare or something like that, that allows them to move up that ladder and to make sure that they're more stabilized. Accessing community resources, so like food banks. So now they have a better access to actual nutritious food. Not always probably the greatest, but at the end of the day, it's something, right?
Yeah, it's fulfill the food and water.
Yeah, and applications to appropriate housing, right? Fortunately, the cost of the housing market in Ontario and most of Canada is quite expensive these days. But trying to find an appropriate match in housing. If someone if, let's say, they're on a disability support program, for example, and they're only getting maybe say like 11 something in income, then what can they do, because they don't want to have all their money go towards their housing itself. So making sure that they are able to address their other needs with that income itself. So if that means applying to rent gear to income properties and stuff like that. But unfortunately, also there's the other point of it where there's long wait lists for that. I had an individual that I was working with, and the wait list was, they had just gotten off the wait list, and it took them 14 years.
14 years.
Yeah, to get an appropriate housing that worked with their income itself. So they were precariously housed for that long, and it's very heartbreaking itself. But yeah, so as a social worker, kind of like working in those ways to kind of address those needs, and that will stabilize most people, and then going back to the hierarchy of needs. So once that, you're able to move up that sort of chain, and then you can be more fulfilled and have less mental health illnesses or concerns itself.
Right. And with all of that given, which group are the most prone to the mental condition?
That's that's an interesting question, because it's kind of, there really is no group exempt from it. Children and youth experience mental health rates in Canada of 1 in 5 at least. That's just what's reported these days. That's not including how culture gets put into this, or someone's background. There's a lot of communities out there that may not be willing to accept or be accommodating to someone who has about mental health. They also coming from a West Indian background itself. That was not something that was talked about itself. So this change to say like, well, like we had to survive, so we didn't have the time to feel depressed or anxious. We just had to do something to survive. It's very different from now, like, in different countries when people move and stuff like that. It's like, well, like I'm upset because I'm not included. It's like, well, who cares if you're included? Like, you need to survive, and I came to this country to kind of make sure you had a better outcome. So, like, this is nothing, but it's a very different mindset itself. So and then even like child rearing practices, what's considered discipline versus abuse or neglect, right? Those impact the children, in very different ways, but also just how they're compared to their peers, and especially with the rise of social media these days, that's a big one. Oh my gosh, like see everyone with these painted lives of like, they've got their boat and their cottage and all this stuff, and you've got someone whose family really can't afford that stuff, but and they think their life is worse off because they can't do that type of stuff, right? So yeah, so there's a big proponent of children and youth that experience that, and I feel that's getting worse with social media. It's kind of a bias of mine, but that's it is what it is. Obviously, and about 70% of all mental illnesses start in childhood itself. So if they're not addressed, I'm just kind of, we were talking about earlier about the brain sort of changing as a result of the experiences we do. That's typically what happens. So their brain changes and it continues on, and it may not be addressed if they have poor access to mental health services, or even the right conditions to start to change that, or even just someone who they feel they can talk to. That's a big thing. The isolation and just not feeling like they're able to talk about things that are uncomfortable is a big thing, and then that grows into people who are adults and young adults and adults and stuff like that. And typically by that point, if it hasn't been addressed, those people are still experiencing their same problems itself. And and as a social worker, I can work with people like all day long, but if they're not willing to learn how to change, which you would experience as a personal trainer, if someone says they want to lose weight and they aren't able to adjust their diet accordingly, or learn to like they feel like they can't move up in a weight to actually strain the muscle, right? Those conditions continue on, so that the rate of mental health in adults, 1 in 5 to 1 in 4 now. So it's a big problem. And then even seniors and older adults, they experience adverse mental health conditions. I think there's a stat going around right now. Approximately up to 30% of individuals 65 and up have a mental health concern itself. So, and that's attributed to a lot of things, So assuming nothing's changed over a childhood or even an adult span, right? Those become, the functional states, but then someone who gets older and their body starts not working as it used to, right? So they're not able to walk properly or as they did once. They're not able to lift. They're not able to clean their house like they wanted to before. All these things come into play, and it really impacts their sense of self and their sense of worth. And so, and especially as I work in a long-term care facility, I see that all the time. People are like, I used to run like every day. I used to swim or do this. I used to, go out and see my friends all the time, and now I'm stuck in a wheelchair. Or I have a chronic condition that, I can barely walk 5 steps without me falling. Or, they they can't wrap their head around such a drastic change in their health function because it's not who they know themselves as. So there's no group excluded from it. It's definitely harder to address it at the older ages itself because a lot of the brain has solidified into a way that it's kind of worked itself, and to change that they may not have the energy for it, or the patience itself, or so it's kind of all over the place. But intervention at any age is helpful. But yeah,
I have learned one thing since the day I started working as a personal trainer is that not all the time thinking about what you used to be able to do in the past can become a motivation for people, because so often, more often than not, when people come to me and then they say that they used to be able to do this, do that in the past, especially these days before COVID.
for sure.
And now they wanted to do that again. And then once we actually use those activities as the anchor for their motivation, it worked in the way is we didn't even expect it to work.
Mm-hmm.
They start to feel very discouraged because they don't see the progression that fast enough for them to become their old self again.
Mm-hmm.
What we're gonna have to be sure right there is that like you are not just only fighting the condition that you've been stuck into during the whole pandemic and all the time you've been sitting on the chair,
Right.
but it's also about the time that you are getting older now.
Mm-hmm.
Right? A lot of people come to me at that point where they're already in their 40s, in their 50s, and in that time the rate of degeneration is much higher, and they didn't even aware of that.
Yeah.
And it's just difficult for them to actually even comprehend how much of downfall they are going, and it leads to all the stuff of like false expectation.
Mm-hmm.
And way too high of expectation where they just like, oh, I will never get it anymore.
Yeah.
What is your advice to just youth in these in the culture, in the society today, with like all of the overwhelming culture and social media, to seek out for help when they need to, even like just to be aware of the condition that they need help?
Yeah, that's a tough one. I mean, obviously, being okay with even just admitting to yourself is an important part of starting to seek out help, and making sure that someone is healthy and or mentally healthy, even just in the long run itself. Um, there's just from my own personal experience, it took me a while before I really even started addressing my own concerns. And it's not that I didn't know they were there, but I just didn't feel like I had sort of the ability or the know-how to where to look and who to talk to. And, if I, when I started to, and that was probably like close to the end of high school itself, I really had to start looking at places, but then of course the continuity of care wasn't there as well, because I started looking maybe in my last year of high school, but then of course I had no longer access to those services because I was considered a bit of an adult. So then I had to look for something else, and then so it's hard, and it takes a lot of patience, and I know I can see there's definitely a lot different how from impatience itself just alone. Like even if I look at myself, years ago I used to be okay with like just waiting for dial up and letting things wait to download, and yeah, how many times you've seen that, like, oh yeah, I'm gonna download this file, 39 hours, okay, I totally got it. Now these days most things are downloaded in like what, 30 seconds.
That's very true.
So yeah, and even if I guarantee you if I went back to like dial up now, I would be pulling my hair out because I could not handle just the lack of like sort of instant gratification that the advancements in telecommunications and everything has afforded me these days. Or I always joke a lot with a lot of my peers and friends. I used to get up all the time every Saturday to watch Saturday morning cartoons. Now anyone can stream those at any given time itself. That's just such a weird concept to me because it was such a part of my morning routine. But yeah, just being patient and really giving yourself the grace to kind of be okay to ask, and being scared to ask, and sort of understanding who you can turn to is an important part of it too. If you feel like your parents aren't something you're comfortable with, or just you turn to school programs, or you turn to distress centers or something like that. So there's services out there, but there's always this kind of asterisk on it itself in terms of how it will be seen if I start to access this. But that's starting to change a lot. We have like mental health days that are incorporated in jobs and stuff like that. You have these big campaigns like Bell's Let's Talk and stuff like that. So all these programs are starting to come out that really are trying to push that stigma away. But it's still a long and hard process to really do. But yeah, my biggest advice would probably be patience itself. Really being patient, and patient with things around you, but also patient with yourself to really take things and do what you need to do one step at a time.
That's a very great advice. But it also bring up another question in my mind.
Okay.
So you said that you were aware of some of the mental condition that you had in the past, right? But I believe that there are so many people, they are not even aware of that. What are the signs of having a mental issue?
There's a lot. I mean, it depends. I think anxiety is a big one. They may just, a lot of people may feel like, or may denote it as being shy, or just scared to fail and stuff like that, right? And so they push for perfectionism itself in whatever they do. Some of that gets so ingrained into our own personality that it's we lose sight of it itself. So that's exactly what you're speaking to, in that you just don't really know it's there. But there are physical signs. People with depression or anxiety, they tend to experience a lot of fatigue. So not being able to really get out and do things, or do the things they like to enjoy, if they lose interest in that stuff, that's a big sign, right? I know this happened with me. Eating was a big source of pleasure that I got itself, and it sounds kind of weird saying that, but I felt good eating because it reduced the stress. But of course, I was typically turning to food that wasn't great itself, like a lot of junk food burgers and chips and cookies and pop and all that stuff. So if a bad mental health state will typically lead you to other things that help you cope, but may not be the most healthy for you itself. And that could lead into a bigger discussion about like substance use and stuff like that. If someone feels that the only way they can get through the day, like and not typically with children, but or youth, but it does happen. Starting to look into alcohol use or smoking through like vaping, uh, cannabis and stuff like that. May not be the healthiest solution, but it's a coping mechanism, right? If you feel that you need something to really get yourself through the day, it's not always. It might be a bigger indicator of something needing to be addressed itself, right? That could again open up a bigger discussion on a lot of things people do in this day to day just to get through, coffee or just like snacks and stuff like that. But at the end of the day, it's just they are a bit of an indicative sign of something being there. So yeah, fatigue, bad coping mechanisms itself, loss of interest. I would say those are some of the big indicators itself. A lot of confusion and just not really feeling in place or, accepting of who you are. It's hard. I do feel like a lot of youth these days, and this is probably a social media or a big impact as a result of social media. They see life through a different lens of something on a screen, and they think the grass is greener on the other side, and not always is it. Not always is it. So, yeah.
I see. There, there's a sense then that I really like, and I really keep it in my mind, which is you want to chase your happiness instead of chasing pleasure. And from what you just say, that when people start to lose a sense of what they are interested in, they start to lose a sense of being included in the society.
Mm-hmm.
They reach out to the pleasure, right? Like pornography, like cannabis, like alcohol, party all night. Do you think society these days set people up for that?
In the sense of setting them up to access that stuff more frequently.
Yes.
Yeah, I would definitely agree with that. I mean, you can't walk down any street in Ontario without walking into like 2 to 3 cannabis stores, right? How many vape stores do you see that are within that same span of distance itself? Where a lot of there's more control over alcohol and stuff like that, but and cannabis is still within that frame still too. There's I mean, just like with alcohol, there are people find ways to get around that. Not the greatest, but it happens. Being realistic here. Porn itself, yeah. It's virtually everywhere itself. And we literally have porn accessing devices hidden in our pockets, like at any given time itself. And just seeking out, that type of stuff, it provides us, gratification itself, which is, in the way it's seen kind of biologically itself is that, there's a chemical released in our brain whenever we do that stuff. And of course we want to chase that feeling because it's good. But is it always good for us? Probably not. Increases in porn consumption is linked to very bad sexual health relationships itself, and a lot of poor body dysmorphia. It's a big thing. So it's definitely definitely harder to kind kind of get away from it these days.
Yeah, absolutely. I believe like all of those substance and service are really try to trick our brain to produce something we think it was a happiness or pleasure, like the comfortable feeling, but in a very very artificial way, which is always not the best.
Yeah.
Or you want it to happen very organic. Yes. Um, so with that knowledge, how do you and your college as a social worker help with all of those problems?
So yeah, so social workers work in many different fields itself. As part of the helping professions itself, we can work in very different ways. So the big one a lot of people know about is through like counseling and providing therapy and stuff like that. So you can look up tons of private practices or people that provide services through organizations itself, like outpatient mental health clinics and stuff like that. So they provide support through that. Um, Policy development, which is not really talked about a lot. So um, social workers can go into government agencies and develop policies to or and how that implements towards legislation and stuff like that in terms of what is acceptable, what is not, in terms of the eyes of the government itself, and advocating for policy changes. If policies or legislation is a bit discriminatory itself, to certain groups, or they can appeal to the governments and stuff like that. So you say like, this doesn't make sense. Let's change it for the better itself. If we want a more inclusive environment itself. Research, research is a big thing, and not always the easiest thing as well. Something I look to get into myself at some point, but just being able to see how if something, if a certain intervention works well with a certain population, or what kind of data is needed to actually inform government policy and funding and spending into what helps people. And then sort of in line with that is program development itself. So once that data has been collected and identified and gaps are starting to be acknowledged itself, we need to build like there seems to be a lack of access to mental health resources in this let's say northern parts of the country itself. We need to be able to have better access for that, and so we need to allocate funds, and then this is kind of those type of service that will probably be beneficial, and we have to incorporate for cultural areas and stuff like that. Then on top of that, other ways. So advocacy and social justice itself. So, social justice. Whenever I say that, everyone kind of pictures like people with picket signs and stuff like that. But at the end of the day, that does help, right? Being able to push for government change through advocating for what is right for groups to be included or not to be left out, or for things to not be ignored is a big thing. And there's tons of organizations and causes just around the world that benefit from that. And then lastly, kind of where I kind of work a lot in, while I do a little bit of everything in that through my own work, but my big part is system navigation itself. So being able to work with someone individually and go, okay, this is where you're currently at. How do I help you feel more like the person you want to be? So accessing them an income, giving them access to a housing complex that works with their needs. Again, addressing them to appropriate food resources, or making sure that they have access to other services, or even just getting them a phone, especially, which is considered a big part of a standard quality of life these days. Being able to access the internet, and programs for inclusion and social interaction. and just and in times of crisis, being able to go like, okay, like, let's take you to the hospital, or let's take you to CAMH, as everyone knows, and being able to really access the service they need when times aren't great.
That's 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 something that really struck my mind, that a lot of people, they need help to even do anything that we assume that is very basic, like going to see their friend, going to the hospital if they feel sick, right? Even it's just so simple these days. You just click 911 and you just call.
Yeah.
Even you don't even say anything. Probably they're gonna even access you faster than you say something.
Yeah.
Right? But that brings into my mind that like physical state somewhat are very important to maintain a mental health, right? I watched a podcast lately where the guy say that like the most important three organs in the body is the heart, the lungs, and the thigh. Well, we already know that we need heart to live, lungs to live, but thigh for us to walk around and also to stick to where we want to be, right? Which is wild if you think about it. It make a lot of sense that like if you don't have thigh and you stick yourself in a wheelchair and then you can't even access to anything, it's difficult, right? And I work with some client, and especially one client who has some issue with her knees, and it make it much more difficult for her to walk on the stair. And she said that like she never actually go to the subway station because it's actually forced her to walk further to get to the elevator. And she's not willing to do that. She'd rather just call an Uber. But like it's another problem, right? Which is the income. If you don't have money, you can't just call an Uber and then just like go anywhere you want to go. Right? So on the broader term, what is the relationship between one's mental state and physical state?
Yeah. So I think this is encapsulated in a quote by the World Health Organization. That's that kind of puts it all into a nutshell itself. There is no health without mental health. So basically saying that they're so intertwined with each other. People with more that have mental health illnesses or mental health concerns and stuff like that, they are more at risk for chronic conditions. And people with chronic conditions are far more at risk for mental health concerns. And just stating back to your client itself, if I've seen some other videos online as well, and even just in my own work itself, if you're not able to really use your legs and to walk, and that really brings you to your social inclusion and your things that you find meaningful, it really takes a toll itself. So they're very dependent on each other. If and without being able to access other things, like not everyone can afford an Uber, or if they depend on services like Wheel-Trans, which is an accessible transport service itself. But it's very inconsistent itself. Not to criticize the program. It's a very important program, but it has thousands upon thousands of clients that all need to go somewhere, and they have to plan routes accordingly. And their times could be a little bit all over the place itself as a result of that. And or then you could look into cabs. Cabs are expensive itself, and all of these, like a taxi.
Oh, okay.
Yeah. So all of these things impact each other, and just being able to support a person's proper mental health. So definitely, if your lower body strength is not there, it really impacts your your quality of life and your mental health. But also even just a whole body fitness itself. Not being able to if you're very overweight and you're having trouble breathing, and or just even kind of moving around. It limits your ability to do things. Or if you're dependent on like a scooter or a walker, um, not always safe to use those when there's places that don't have elevators and require stairs. And there's a lot of policies in here to develop, in Ontario to develop accessible spaces, but it's behind on its timeline itself, and a lot of people suffer as a result of that. And it's not to point blame or anything like that, but the reality is that people get impacted as a result.
Right. How about the other way? Because you say they are intertwined.
Mm-hmm.
How does the physical state be impacted by a downgrade in mental state?
So those with big mental health concerns itself, they don't have, people with depression, for example, may not have the motivation to get up and go work out, or go see their friends, or do things that they enjoy. And as a result, if they stay at home a lot, they eat more junk food, because they're chasing that that pleasure itself that they get from that type of stuff. So that lack of mental health impacts their physical health, and this cycle kind of goes around in circles.
Absolutely, yes. And when you step into that, doesn't really matter. When you step in, you're gonna just get
exactly
into the cycle. Yes.
So it's really intertwined, and it's hard to pull apart it from each other itself. And the better you feel, the more conscious you are of making healthier choices, or more, I shouldn't say healthier choices, but just choices that work better for your lifestyle. Before, like like I would come home from school, for example, like and I would would be so stressed, but I would like go for like a burger, I would go for like chips or something like that. Now, incorporating my own health journey and my own weight loss journey and stuff like that, it's like, oh, okay, like I've done that, now I've worked out and I feel a little bit better. Now how do I continue to work with that so I don't go back in my results? So okay, I'll eat a salad, I'll focus on eating more protein and more veggies and stuff like that, and it works together. So if you really don't have one, you don't have the other.
That's very true. Is there any way to know which way is better to start first? Which one you're gonna tackle first?
Yeah.
Physical or mental?
That is, I think, dependent on the person itself. Some might find it better to attack the mental health aspect first, because then they feel they actually can motivate themselves to do the physical thing. Other people, and this is a lot with gym culture itself. You see those tons of memes all over the place where, and reels where people are like, "Oh, let's not talk about our feelings, but we can work out," but they feel good from it, right? So, but it needs both of them to be addressed in some capacity. But where someone might find something easier to start with is the route to go itself. So, like for myself, I started addressing the mental health concern first, and then while I was like working out here and there, I didn't really have maybe the proper motivation is the right word to kind of describe how I was doing, how I was going about things itself. And then I focused a lot on my studies, and then things in my physical world kind of rolled back a bit. And then, but then being more solidified with things, I started, going back to the gym more regularly. I signed up with training with you, and being able to really start pushing things a little bit more and make sure I did things safely. So, to everyone their own itself, but yeah. And I think the big part that also needs to incorporate is how what we call states of change itself. If someone is not in a state of change to address one thing, they will not do it, right? So if someone's not in a state of change to address their mental health, then it's the physical thing that they should try to. and then vice versa. The reality is, though, too, there are people out there who aren't in a state of change for either. So it really depends on the person for what they feel will be the best way. If they are in that place or they're thinking about that place, that would be the way to go.
Right. So it's about a lot of try and realize.
Yeah.
Does it have any like negative impact on that process if you try and realize that it's not for you?
I mean, it definitely can. Like, there's times, even before I started, when I was going to the gym before and not really getting results as I would have liked itself. And, this is something you kind of helped me with too, is that, I would, try and figure out my form for like a squat or something like that. And it wouldn't feel great. And like people would, tell me things and I couldn't figure out how to really adjust it on my own. So having feedback and learning where things are, if I didn't have that, I probably wouldn't have continued with things. So if you go to something and it just doesn't feel like, or you get scared, or like you try and be super perfect and you can't do it, and then you're also really negative on yourself, of course it's going to impact your ability to do things. If you expect to go to therapy and counseling and be like, I need to address these, and and you don't feel like your therapist is addressing those things because they're talking about other things that actually have to do with it. It's but looking at other aspects before they get to that point, and it's not the immediate concern, then obviously someone's going to be like, well, it's not for me, right? So it's all of that is all over the place itself.
Right, it's very individual,
Yeah.
and then sometimes it's very difficult to actually find a sweet spot where how much you need it, because even in my work, there's a lot of things that I know they will benefit very well from it, but I also know that if we do it right at the moment, they're gonna get frustrated and they will stop doing everything.
Mm-hmm.
And I think it's quite the same in mental, where like professionals know that if they do this properly, then they will find much better.
Mm-hmm.
But it's just they are just not in the position to do it, or maybe they are not willing to do it, right? And
Mm-hmm.
then if they are being forced into that, it may backfire very badly, and then everything gonna going really really downhill. I gotta really respect the boundary and the mindset, also expectation of people.
Mm-hmm.
Based on my experience, most of the time people will feel better after they work out if they haven't had that part as their daily routine.
Mm-hmm.
So like if it's something new, then they're gonna start to feel better. Of course, after the first week where they feel like really sore, yes. But yes, after that they're gonna start to feel better. And they're gonna just keep going up until one point where they start to doubt themselves that like, am I doing things correctly?
Mm-hmm.
Am I seeing the progression? Maybe not, then maybe it is where I stop, right? So that's when we talk about like having a personal trainer to get you through that.
Mm-hmm.
Was it difficult for you at the beginning to decide to start with a personal trainer?
It was a bit, especially when I started again. I was in my I'm in my 30s itself, and I didn't feel like I had the know-how to really start doing things properly on my own. And of course, with the changes in my body, and the weight that I put on during the pandemic itself, sitting in bed most days because I was doing my master's at the time. And so I didn't really know what my body was like, or really to kind of how to address things. And so it was hard because obviously I know there's a cost that comes with it itself. And I'm very much a proponent. There's nothing in this world that doesn't come with a cost itself, whether it's actually monetary or something else. But understanding that like, okay, I really don't know, and I really don't know how to trust my body yet in terms of what I want to do or where I want to get back to. So I need a guide, and that was my ultimate decision on getting a personal trainer itself.
So first, you admit that you didn't know much, and you admit your position in the situation itself, right?
Yeah.
Then after that, you act on it.
Yeah.
And I assume that will be the same for the mental.
Yeah, exactly. And just going back to the physical part, like I used to go to the gym a bunch of times, but I wasn't seeing the results, and that's a bit of a bias. I know we've talked about this before, like where I'm like I can't tell if I'm actually making progress or like if my body is changing yet. Like I hear comments from other people going like, you're looking smaller. I'm like, really? I can't tell. So it's the same thing. With the mental health sphere. If it's like doing reps, for squats and stuff like that. You only when you start to process things more, then you start to realize, oh, the stuff that I was talking about before, or was discussing, the work that comes with, the mental health work, I should say. Then you start to see what things do when you hit that big milestone, and then things change, and then, as you work on other things, you may get into a bit of a lull, just like with working out, that, you don't know how things are going until events come up, and then you go like, oh, I can handle this a lot better than I used to itself. So they're definitely very similar in their progression itself.
That's something I realize that a lot of time I have to help my client with, which is helping them to know that they are making progression, because sometimes the progression is just not what they imagine in their mind.
Oh, for sure. And like, I think the big one too, like, and again, this is something you and I have talked about at times, where I don't see the number on the scale changing, but my body composition is changing itself, and that's hard to see because I can't see my body composition all that time. But in terms of fat percentage and stuff like that, and the way muscle is growing, it changes the body, but because I can't see it, it makes it very difficult and not very gratifying.
Oh, for sure. Definitely. I think it's something we should and we need to do better as the fitness industry. We need to be more open about the realistic expectation for people to understand that sometimes you make the change that's very healthy for you, and that change unnecessarily needs to be tangible. When you can see it, right? And also there will be so many different ways to measure the health of somebody, to see like whether you are healthy or not. And most of the time, all the number that we put on internet, even being suggested by World Health Organization, they all are for general population, and of course, because they are the worldwide recommendation, it doesn't really being specialized into your situation, like where do you live, what race are you, how big you are, how your stress level look like during the day, right? Yeah. So I'm sure we need to do better in that part of like bringing to much more insight of fitness for people to have like more realistic expectation on their own change, right? Yeah. Let's say if you can't even walk 100 meters without our breath 2 months ago, and now you can literally walk to Loblaws, get grocery, come back, and feel okay. That's a big progression. Yeah, that's a really big progression. As I say that, like some people can't even walk to see their friend. You can still do that, so that's great, right?
I hope to maintain that for quite some time.
Yes. Yeah. So, and then again, it's just like our face and representative are so good looking. They all like six pack, big pack, big biceps, yes, big bum, and people think that like unless I look like them, I'm not healthy, right? But actually, it's not that true. Maybe those people are not healthy as well. Yeah. you can't really say whether it's somebody healthy or not just by the look.
Yeah.
Especially even when it's just come to like fat and weight being deposited into your body, right? Like we have a conversation about that.
Yeah.
We talk about glucose and fructose, where like there are mainly three positions of the fat that's being deposited in your body, and then there will be different amount of fat being deposited into the specific position before you become metabolically ill. So like sometimes it just doesn't show, because like if you have fat in your liver, it's hard to tell.
Yeah.
It's hard to tell from just a look, right? But it's actually one of the worst position where you want your fat to be.
Exactly.
Right? In your organ, that's the worst thing. You really want to address that, right? But if you have a lot of fat in your bum, oh man, it's amazing, right? Like, it's great. Not gonna kill anyone, but yes, people don't like it. People want to look thin, and people think that, yeah, if I look thin, I'm gonna be healthy. And I think it's the same for the mental. If somebody can still live very comfortably with their coping mechanism, doesn't really matter whether it's based on a lot of pleasure and not so much of happiness.
Yeah.
They still think that they are in a good spot where nothing they need to address, or maybe they just don't even have time to address that, right? And by bringing up the awareness of it's okay to get help, you are not a bad person if you reach out for help, right? That really helpful for people to feel a little bit better, especially when we talk about mental, right? They're already being damaged, and now if they even feel bad to seek out for help, it's make it even worse, right? So yes, I hope this conversation will bring up more insight to people and encourage them to seek out for help. First, being aware of their condition. Second, admit to themselves at least, right? And eventually not afraid, or even maybe accept that they are afraid to try, but just try it anyway.
Yeah.
Just same with what we do in the gym, right? And I always think that regardless whether it's negative or positive, your emotions are there for a reason. Even if you are feeling terribly, they are there for a reason. It's not against you, but it's more like a trying to protect you. It's just maybe it doesn't work the way you want it to work, right? And the first thing to make it take advantage out of it is be aware of that and admit that it's happening, instead of redirecting you to the different area so you don't have to look at that ugly part, right? Yeah. So that's what I learned from this conversation. Yes. And also like the very intertwined relationship between physical and mental state. Also, before this conversation, I actually didn't think of that, like everyone are so prone to the mental condition, especially youth and early adults. And it's very important to know, especially it's very relatable to me since I'm in that range of age, especially everyone around me also kind of around that range of age as well. So yeah, it's really good to have awareness of that, and eventually is all the stuff that we've been dealing in society right now is helpful, but sometimes it's also bringing more of risk, and I would say it actually facilitate a little bit more of mental issue, and we need to be aware of it. Right? Good thing come with bad thing, of course.
Like I said, there's nothing that comes in this world without a cost, and it's just a matter of the cost being more apparent right off the bat versus sort of hidden in the weeds a little bit.
That's true. Which one do you like better?
I mean, I sometimes prefer it up front, but that also comes sometimes with those little anxieties brought forward with it itself. And of course, like I'm just in the process of getting a car right now, and it's of course like having to spend the money. I was like, that's a lot of money, but okay.
Yeah. That's very true.
But it's and at the end of the day, just going back to something you said, our emotions are here to help us. they are intimidating, and just a lot of them are not really talked about in normal day to day. A lot of things are still considered taboo to talk about or think about itself. But being able to see, if you're feeling anxious about, let's say, starting therapy or going to the gym and stuff like that, it's just because it's out of your normal sphere of things that you're used to doing. And typically, if it's considered something of positive benefit, it's a good thing. But it's hard because a lot of our emotions are meant to keep us alive, and without that, we have no sort of filter on kind of what can be good or bad for us. So
That's very true. Thank you so much for coming here today. It was a very interesting conversation with you, and I have learned a lot. I hope in the future we're gonna have more conversation like this, and I hope all the best for you mentally and physically.
Same for you.
Thank you so much.